everyone. So let's get into the video. So in this video we are going to start up with our electrocardiograph. So it's a very interesting topic and I like it very much. So let's begin the video. Electrocardiograph. So what is electrocardiograph? You probably be familiar with the typical hospital television shows like in serials. We used to see that there is a patient lying. Okay, there are doctors and there is a machine. It shows P like these kind of. We all are familiar of this. So that's the screen which traces are the voltage and which monitors and traces on screen, makes the sound beep 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 and beep as the patient goes into the cardiac arrest. And this kind of machine is called as electrocardiograph. It is used to obtain the electrocardiogram, like it shows the graphical representation of the electrical activity of our heart during the cardiac cycle. So to obtain the standard ECG it is used. Okay, this is how it looks like, and this is the dramatical and diagrammatic representation of the standard ECG. It looks like this. Okay, and a patient is connected to the machine with the three electrical leads. Okay, and one is to the waist, second is to the left ankle, and we also have some leads attached to the chest region of the patient, and it detects the evaluation of our heart function. It is connected to the three electrical leads are connected to waist, wrist, and left ankle and chest region. And here we talk about the it tells the standard ECG. Now each peak in the ECG is identified from letter P to T that corresponds to the specific electrical activity of the heart. PV represents the excitation when the heart excitation, or we can say depolarization of the atria, and QRS represents the depolarization of the ventricles. P will represent depolarization of atria, and QRS will represent the depolarization of ventricles. Okay, and the contraction starts shortly after Q and the beginning of systole. The T wave returns to the ventricle from the excited to normal. When it returns from the excited state to the normal state of the ventricle, then it is called as repolarization. Re means it will remain. It will again gets to its normal position from the excited one. Okay, and by counting the numbers of QRS complexes, one can determine the heartbeat rate of the individual. And since ECG is obtained from different individuals have roughly the same shape for the given lead configuration, any deviation from its shape indicates a possible abnormality or any disease. Okay, and hence it is a great clinical significance. Double circulation. Let's talk about double circulation. Double circulation, the blood flows strictly by a fixed routine through the blood vessels, atria and veins. It flows strictly in a fixed routine, and basically each artery or vein consists of three layers, and this is the inner lining is done by our squamous endothelium, and the tunica intima, middle layer of smooth muscle and elastic fibers. The tunica media, external layer of fibrous connective tissue with collagen fiber. Tunica externa. Tunica media is comparatively very thin as we are comparing the veins, and as mentioned earlier, the blood pumped by the right enters our pulmonary artery, whereas the left ventricle pumps the blood into the aorta. Okay, the oxygenated blood pumped into the pulmonary artery, passed on the lungs, from where the oxygenated blood is carried out by the pulmonary vein to the left atrium. Pathway consists of pulmonary circulation, and the oxygenated blood entering the aorta is carried by a network of arteries, arterioles, and the capillaries to the tissues, and where the deoxygenated blood is collected by a system of venules. Okay, and venules, veins, vena cava, and emptied into the right atrium. This is the systematic circulation. That's how the system performs the circulation, and how the it provides the nutrients and O2 and other essential substances to the tissues, and takes out the CO2 and other harmful or toxic substances for the elimination in our surrounding. Okay, so a unique vascular connection exists between the digestive tract and liver, which is called as hepatic portal system. What is it called as? It is called as hepatic portal system. Hepatic portal veins carries blood from the intestine to the liver before it is delivered to the systemic circulation. A special coronary system of blood pressures is present in our body exclusively. Okay, for the circulation of our blood to and fro from the cardiac musculature. Okay, so this is our lungs, this is the pulmonary artery, pulmonary vein. Okay, from here it will go here, and dorsal aorta, then it will go to here. This is lumen, artery, smooth muscle, and this is the body parts, and from here it will go. This is again vein, lumen, smooth muscle, and through the vena cava it will go here. This is how the uh, schematic plan of the blood circulation in human beings. Now let's talk about the regulation of cardiac activity. That how the cardiac activities are regulated. Normal activities of the heart are regulated intrinsically. ठीक है, ऑटो रेगुलेटेड होती है बाय द मसल्स, नोडल टिश्यू, और इसलिए हम हार्ट को कहते हैं मायोजेनिक. एंड द a special neural center in the medulla oblongata can moderate the cardiac functions. Medulla oblongata can moderate the cardiac function through the autonomic nervous system. Autonomic nervous system. Neural signals through sympath, symp- maybe you are able to listen to the background noise. Very sorry for that. Neural signals through the sympathetic nerves. Okay, it can increase the rate of heartbeat and the strength of ventricular contraction, and thereby the cardiac output also. On the other hand, the parasympathetic neural signals, another component of ANS, decrease the rate of heartbeat. It will increase there and it will decrease, and it will also speed of the conduction of active action potential, and therefore thereby the cardiac output. Adrenal medullary hormones can also increase the cardiac output. Disorders of circulatory system. What are the disorders? First one is high blood pressure, which is called as hypertension. Hypertension is a term for the blood pressure that is higher, which is higher than the normal. The normal is 120/80. Okay, in this measurement 120 mmHg millimeters of mercury pressure is the systole or pumping pressure, and 80 mmHg is the diastole or the resting pressure. If repeated checks of blood pressure of an individual is 140/90. Okay, 140/90 or higher than that. Okay, it shows hypertension. High blood pressure leads to the heart disease and also can affect our vital organs like our brain or kidney gets affected by it. So it is important to take care of ourselves, as hypertension can lead to your disorders in your brains and kidneys. Second one is coronary artery disease, CAD. It is often referred to as the atherosclerosis. Atherosclerosis. It affects the vessels that supply blood to the heart muscle. It can affect that vessels which are responsible to supply the blood to the heart muscle, and it is caused by deposit of calcium or any fat or cholesterol or even the fibrous tissues, which makes the lumen of arteries narrower. It makes the arteries more narrower, so that there is difficulty to supply the blood to the heart. Okay, what is it? CAT. Next one is angina. Angina, called as angina pectoris, and is a symptom of acute chest pain appears. When the acute chest pain appears and there is no enough oxygen is reaching to the heart muscle, then it can occur in men and women of any age. There's no specific age for it. It can happen in any age, and but it is more common among the middle aged and the elderly age. It occurs due to the condition that affects the blood flow. It is due to the any disorder in the blood flow, we can say. Next one is heart failure. Heart failure means the state of heart when it is not pumping and the blood effectively enough to meet the needs of the body. Means that the blood is not getting pumped. Okay, and the needs of the body are not getting enough, not able to supply that needs. Okay, and it is sometimes called as congestive heart failure, because the congestion of the lungs is one of the main symptoms of the disease. Okay, and heart failure is not the same as cardiac arrest. It is somehow different from the cardiac arrest. Okay, cardiac arrest is something when the heart stops breathing. Okay, and or a heart attack, it is different from that. Heart failure is very different from the cardiac arrest and from the heart attack also. Heart attack is when the heart muscle is suddenly gets damaged or inadequate blood supply. Okay, so the chapter is finished. Thank you for watching this video.